While KevinMD.com is the web's leading destination for physician insight on breaking medical news, I find it to be an incredibly useful patient tool because by reading all these blog entries, I get a perspective of what my doctors are up against. It's almost like a very practical reality show where I get to see the pressures they're under, the constraints they must deal with, the edicts they get from health insurance companies, and what they're thinking. So to that end, I find reading your blog incredibly helpful. But for other patients out there who might be intimidated by a blog that is basically a physician-written blog, what can you say to them in terms of how can they get the most out of reading your blog and going to your website? Because I know that there's many sections on the blog.
Well, first of all, I think the way that you've described how you read a blog is exactly how I envision patients to consume that information. One of the primary goals I have is for patients to hear the voice of doctors, and not just any doctors, but doctors who are practicing every day. Because a lot of policy, it's made by physicians and politicians who don't necessarily see patients every day. And although I have some of that, most of my guest physicians who write on my blog, they're doctors like myself. They're doctors who see patients on the ground, so to speak, and not policy experts who are in academic centers who don't necessarily see patients. So we understand and we see the difficulties that patients go through. So it's important to share that perspective. One of the more common issues that come up that I get from patients, they ask me, why do I have to wait so long in the exam room? And there are a lot of physician posts who give behind the scenes of some of the difficulties we face. We don't want to make patients wait in the exam room. We hate it when we run late, but there are just forces beyond our control that sometimes patients don't understand. So it's important to convey that perspective. So there's definitely that, getting in the shoes of the physician and seeing the healthcare system from their perspective. A second way is I have posts that are more factual in nature. If you look under the conditions tab, which goes to more factual posts. So in some cases, I would write about the flu vaccine. There'll be less opinion-based and more medical factual. We'll talk about some specific conditions, some of the latest treatments. Every day, I will cite 3 stories from MedPage Today, in which I'm affiliated with, and share some breaking medical news. So patients can use my blog to keep up on some of the latest headlines. And a third way patients can be involved is by becoming involved with the discussion that follows every post. Because not only do I have opinion from physicians and other healthcare professionals, there's always vigorous discussion that happens everywhere. Because as we know in healthcare, there are very few issues that everyone agrees on. And it's important to have that type of debate in a forum, especially when it comes to health policy and healthcare reform. Most recently, we're talking about gun control and what physicians' role in that is. And of course, these are provocative topics that deserve a lot of discussion and debate. And we definitely have some vigorous debate that sometimes grows pretty contentious, as you can imagine, with these issues that follow each blog post. And I think you can learn a tremendous amount from reading from people that you don't necessarily agree with. I know I have. I've learned a tremendous amount reading from people across the political spectrum. And I think you get an appreciation for what the other side thinks of a certain issue. And that's the type of bipartisan balanced post that I try to bring on my own site. Whenever I have a progressive viewpoint, for instance, I always try to balance it with a conservative one a few days later, because I do want my readers to get a full spectrum of all the issues that we face in healthcare.
What is your take on online patient-physician reviews?
I think they should embrace them, because no matter what doctors think, more patients are going to rate them and talk about them online. Healthcare in general is becoming more transparent, and you see it in other areas, whether it's books, movies, hotels. Everyone is talking about them, they're rating them, and they're reviewing them online. And it's inevitable that that's going to come to healthcare as well. And whenever I bring up the subject of online ratings and physician reviews to other doctors, you can see a certain look come across their faces. You can see a chill down their spine because they really hate them.
Mm-hmm.
And I think it's because doctors aren't used to that type of feedback and transparency. So there are a few points that I give to them. Number one is that they should listen to these physician reviews because a lot of these comments aren't because the doctors necessarily gave patients bad care. It's because the magazines were out of date. The office was too cold.
Right.
There wasn't enough parking. These are all things that could be corrected. Sometimes if the care is criticized, it's something that I think doctors need to hear about. So the first thing I would recommend is to read them, listen to them, and correct anything that could be corrected. The second point I express to doctors is that they've done studies on these online rating sites and found that 90% of these ratings are in fact positive. They're actually patients who like their doctors. They like their care. So one way that I ask doctors to help improve their online reputation is asking more patients to rate them online. And they shouldn't just cherry pick the good ones, but just ask all their patients to rate them online. Give them instructions to do so. And if the studies are correct, chances are a lot of those ratings will be better than a lot of doctors would think and can drown out some outlier negative reviews that could be left by a disgruntled patient. So the point is that the medical profession needs to embrace online ratings and physician reviews. And in my book, where I talk about online reputation management, I offer these type of tips that doctors can do to help be proactive and control their online presence and define themselves online by asking more patients to rate them rather than being at the whims of someone who's disgruntled or someone who may be out to get them. Because I think it's coming, and whether doctors like it or not.
I don't care if my physicians have a presence in healthcare social media. They are a bit older, so, I don't expect them to have a presence, but I do care that they're up to date, cutting edge on everything about the newest drugs, the newest treatments. But many medical professionals I meet in healthcare social media, they seem sometimes to be a bit too obsessed with being noticed in healthcare social media, almost as if word of mouth and great results don't seem to matter anymore. In that regard, do you think physicians should guard against losing sight of the big picture when they make forays into healthcare social media?
I think the first part rings true. There are a lot of doctors, as I mentioned before, who are skittish or apprehensive about going into social media. And the one thing I talk about is that you shouldn't force any doctor into something that they're not comfortable with. For instance, there are some doctors who are just barely have any type of online digital footprint, and just the fact that they're online and having a profile on LinkedIn, for instance, that could be a lot for them, and you shouldn't push them any more than they're comfortable with. Of course, there are some doctors who go even further, and they're very comfortable engaging patients on Twitter or publishing content on a blog. I think the bottom line is that every physician, they have their own comfort zone when it comes to being online. What I do think all doctors eventually should have is that doctors should be comfortable just having some type of footprint, because if they don't, they're going to be defined by third-party rating sites and things like RateMDs or health grades, where some of that information may or may not be accurate. So I always try to get doctors to be comfortable, at least having some type of digital footprint where they can control that information. But whatever their forays into social media, you're right, they can't lose sight of the doctor-patient relationship. They can't lose sight of the individual patient. If social media comes at the expense of patient care, of course, we don't want to see that. If anything, social media can help enhance it. They can augment it. If we can connect with patients using social media, I think that's all the better, because the reason I encourage doctors to be involved is that that's where the patients are. You have, for instance, pediatricians, where I'm sure the majority of their teens and preteens, they all have mobile phones and they're all on Facebook and Twitter, and sometimes you need to reach them where they are. So there are pediatricians who who have strong Facebook presences, so they can share that type of patient information in a forum where the patients visit regularly. So I think at the end you have to know your audience. Social media definitely should be a tool, and it's a very powerful one, but it shouldn't come at the expense of an individual doctor-patient relationship. But if you use it correctly, I think it could be a powerful way to connect with patients.
Dr. Poe, I will get you out of here on this line of questioning here. My crack research staff has indicated that you are writing a book tentatively titled Establishing, Managing, and Protecting Your Online Reputation, a social media guide for physicians and medical practices. Can you tell us a little bit about the book, and when can we expect it to be available for purchase?
Well, my book is coming out in February, and I talk about how important online reputation is to doctors, other health professionals, and medical practices. I think when it comes to online reputation, I mentioned before that more and more patients are expecting their doctors to have some type of online presence. They're Googling them, for instance, and if a doctor doesn't have an online presence, then they're going to be defined by these third-party rating sites, and what comes up may not exactly be what they want. So in my book, I talk about how doctors can use these free social media platforms, Facebook, Twitter, LinkedIn, blogs, Google+, to help develop content so they can have a strong digital footprint. So when patients inevitably Google their name, doctors and medical practices are in control with what comes up. And the problem with this topic is that a lot of the information about it is scattered across the web. I know I have a few articles on my site. There are a few articles in various online magazines and in blogs, but there's not a consolidated single resource where you could have all that information in one place. And this is what I have in the book. You have all, not only information, but also my own experiences from being both a physician and in social media since 2004. But I don't just include my experiences. I include dozens of anecdotes, case studies, and stories from other physicians as well, other social media experts like Brian Vardabedian, Wendy Sue Swanson, Natasha Burgert. And they tell their own stories on how they incorporate social media into their practices as well, and how they use social media into the workflow of a busy physician. I've also included a voice of patients as well. I've included Carrie Merlin Sparling, Dave DeBronkart, and they give their stories and their perspectives on how they go online to look for doctors. So I think the book is very rich from these stories. It's not just a dry marketing book about why doctors need to be on social media, but it comes from personal experience, but also the experiences of the dozens of social media colleagues that I've connected with over the years. And I'm tremendously excited about it for not only doctors and medical practices, but also patients can get a lot out of it as well, because it really gives a perspective of my own social media journey since 2004. So people who are interested in what I've done or some of the stories and experiences that I've encountered over the years, they can also find that in the book as well.
Last question, Dr. Poe. Will your book that's coming out in February of 2013 be available in various formats such as ebook, audiobook, hardcover, etc.?
Yep, the book can be found on my own site at kevinmd.com. They'll also be available on Amazon, as well as Green Branch Publishing, which is my publisher. And yes, there will be an ebook and eventually an audiobook. But more information will come out at kevinmd.com, where there'll be prominent banners and links telling you where to go to explore it.
Well, I thank you for your time today, and we look forward to ongoing blog posts at kevinmd.com and to the release of your February 2013 forthcoming book. So thank you very much, Dr. Poe, and I wish you great success with your book and continued success with kevinmd.com.
Great. Thank you for the opportunity.